Hi, my name is Kristen Halla, and today we will be talking about health system pharmacy, also known as institutional clinical pharmacy. The learning objectives for today's presentation will be being able to define what a health system is, being able to identify different opportunities for pharmacists in health systems, and being able to describe the different roles a pharmacist can have in different health system pharmacy roles. To start off and get going, let's just talk about what is a health system. When looking into the definition of this, you could find many different definitions, and they may be constantly changing as well. The definition I'd like to go with for today is the Dartmouth College Center of Excellence's definition of a health system. They define health system as an organization that consists of either at least one hospital plus at least one group of physicians or more than one group of physicians. Some examples of some health systems in the Milwaukee, Wisconsin area include Advocate Aurora, Froedtert and Medical College of Wisconsin, or the Veterans Affairs. Next, we will talk about some different opportunities for pharmacists in health systems. There are a variety of roles that pharmacists can take on. Some examples include administrative or leadership roles, ambulatory care roles, which we won't go into a lot of detail today, but more detail will go in week 6. We'll talk about critical care pharmacists today, emergency medicine, hematology oncology pharmacist, infectious disease pharmacist, internal medicine, pharmacy informatic pharmacist, psychiatry, and there are so many more as well that we won't touch on today. So, to start off with the different pharmacists and health system, let's talk a little bit more about administrative and leadership pharmacists. Pharmacists in these positions should have the ability to be able to recognize different pharmacists and pharmacy team members' talents and roles to be able to best get their abilities to work during the day. They should also be able to support and mentor others around them so they can not only succeed in their career, but provide positive benefits for the pharmacy department. It's important for pharmacy leaders to be advocating for their own profession. It also is important that pharmacists in these roles are able to develop different processes and programs to be able to keep the pharmacy department going. By doing these different processes and programs, they need to make sure at the same time that they are following their local health system regulations and standards, as well as following different state and national laws as well. Some different examples of pharmacy administrative roles include a pharmacy manager in a health system. There could be a director of pharmacy role. Also, there could be a role of director of operations for pharmacy. The next type of pharmacist that we'll talk about that can work in a health system is a critical care pharmacist. Pharmacists in this area are typically working with patients who have some type of life-threatening condition, and often they're working in an intensive care unit because that's where their patients are staying at the time. Usually pharmacists working in this environment are working at a very fast-paced role, and they must be able to evaluate a patient rapidly because a patient could change very quickly with what their status is. Besides working in an intensive care unit, pharmacists might be working in other different medical units, surgical units, cardiovascular units, neurological units, and many others. In these settings, they're often not only working with other pharmacists, but they're working typically with a multidisciplinary team, which may be composed of different physicians, other providers, nurses, healthcare professionals, are so many out there. Besides a critical care pharmacist, let's now talk about emergency medicine pharmacist. An emergency medicine pharmacist is a pharmacist who may be working in an emergency department or an emergency room. They typically will provide care to patients who are presenting to these emergency type care. Pharmacists in this setting, kind of similar to the critical care pharmacist, must be able to identify and work with fast-changing patient statuses. So they should be able to quickly assess and differentiate a patient. They may help with different treatments in a variety of different disease states. Pharmacists working in this setting might help with different heart failure exacerbations, heart attacks, pneumonia, asthma, epilepsy, and many other different infections, potentially such as urinary tract infections, skin and soft tissue infections, sepsis, and so on and so forth. Beyond managing different disease states, pharmacists in this setting also should have some emergency preparedness background, as well as they might need to be aware of how different medication toxicities are working and how to help treat some of those as well. The next type of pharmacist role in health system pharmacy we'll talk about is a hematology-oncology pharmacist, also known as an oncology pharmacist or a hem-onc pharmacist. These type of pharmacists work to provide care to those who have cancer. Pharmacists play a vital role in helping with cancer treatment. They may help with assessing and diagnosing different cancers. They may help with the treatment decisions. They may help with different medication managements. And then they may help with different symptom management from the different oncology medications. And they may help with supportive care. Pharmacists in this setting help different providers and patients by helping keep medication lists up to date for patients and helping monitor for different side effects, again, from the different chemotherapy that patients may be receiving. Pharmacists in this setting may work in a variety of settings as well within a health system. They may be working at a cancer center, an academic medical center. They might be at a community hospital, outpatient oncology or infusion center, different organizations, or they might even be working in pharmaceutical industry. Now we'll talk about what an infectious disease pharmacist is. An infectious disease pharmacist, or ID pharmacist, is a pharmacist who will work to provide medication management and recommendations for patients who have various infectious disease-related problems. Infectious disease pharmacists have a great background in different antimicrobial pharmacotherapy for things such as bacterial, viral, fungal, and parasitic infections. These type of pharmacists often are working on a multidisciplinary team as well, with other specialists who focus in infectious disease, such as physicians, advanced practice providers, nurses, microbiologists, and infection control personnel. Infectious disease pharmacists often play key roles in antimicrobial stewardship programs as well in the health systems that they're a part of. What's really interesting with an infectious disease pharmacist role is that they can also work in a variety of settings. They may be working in a hospital in an inpatient setting, or they could be working in an ambulatory care clinic in the outpatient setting, or they even could be working in a setting such as a school of pharmacy. Infection disease pharmacists often are responsible for helping with pharmaceutical care for patients with different infections. In a hospital setting, for example, a pharmacist might help round for different infectious disease throughout the hospital and serve for the hospital as the expert in medications for these different infectious disease states. The next type of pharmacist we'll talk about is an internal medicine pharmacist. Internal medicine pharmacists, again, work with a multidisciplinary team often throughout their workday. They may be working with physician and other members of a healthcare team in a hospital or even in an ambulatory care setting to provide care to patients. In their roles, again, depending where they're working, they may do rounding on a day-to-day to go over the different patients that may be in a hospital. Or if they're in the ambulatory care outpatient clinic setting, they may be talking about the patients for the day each morning by doing daily huddles. Pharmacists in this setting, it can be fairly exciting because they often have a broad scope of knowledge because they're also working to provide care for many different patients with many different disease states. Because these settings can be so variable where pharmacists are practicing, they often can manage a lot of different disease states. So they may be practicing things such as COPD, management for that, management for kidney failure, management for heart failure. The list goes on for what pharmacists in this setting can help manage. We will talk about what pharmacy informaticists do. Pharmacists in this setting definitely work in a niche of pharmacy where they are practicing to work to try to improve health and the care for patients by making sure that the medication process through different health information technology is the best that it can be. They may integrate different data or disseminate different data to different workers within a health system to be able to provide new information or knowledge with the help of different technology and automation to ultimately, again, provide better, safer care for patients. The goal of working with different pharmacy informatics is ultimately to get better health outcomes for patients. Often, a pharmacy informaticist may serve as a liaison for different departments in a healthcare system, and they might have different roles to be able to help promote change with different technologies. The last type of pharmacist role I will talk about today is a psychiatric pharmacist. Pharmacists that work in this setting typically are specializing in a mental health career that is focusing on psychiatric or even neurology. Pharmacists that work in this setting must have an in-depth knowledge of different mental health conditions and their medications, and how to manage the medications, because a lot of medications in this setting not only are we're managing for how well they work, but they need to be managed for how well they might not work, such as side effects that may be happening or potentially different monitoring parameters. Because medications in this setting are usually specific for different disease states, the providers working in this setting must be well versed with working with them, as well as working with other members on the team in this setting again. Pharmacists in this setting might work on different mental health teams and work with providers in that setting. They might actually also be located in a primary care clinic. In other settings, they might work one-on-one with patients directly to try to help them with their mental health conditions and their medications. Pharmacists in this setting, besides working with these different teams, they may work inpatient in a hospital. They could work outpatient in clinics. Again, it is variable where pharmacists in this setting can work. Another setting that pharmacists sometimes in these settings will work will be in prisons or correctional facilities. So there's definitely a variety of settings or roles that a pharmacist can have in psychiatric pharmacy. And that ends my presentation. Here are my references from today's presentation. Thank you for your time.